application. So which is very easy, and comparing with the surgery, it's not so. Open your eye, please. Open your eyes. So I think comparing with the previous time, her effect is not so dominant. So I will make some another 1 millimeter, 2 millimeters from here. So you can check the amount of the treatment after session. So this is very. But when you are doing the upper brachial surgery, you cannot change the original surgical line because it will make some very undesirable effect. But this is not surgery, so you can change the line and you can change the amount. So, but this is very easy, but you know, okay. Okay. I think her eye will be lifting about 1 millimeter from here, about 1 week or 2 weeks later. So I will not treat more because this is optimal. So comparing with the left side, and this is the direct after treatment, and this one is widening than this one. So we can find the conjunctiva of the medial portion and eye puncture. So this, I think, about 1 week later, it will change like this, and 2 weeks later, like this. So you should not treat too much. So because too much, you can change the result. Because but later you can make another treatment. So I will treat the left side. So firstly, I comparing the original line on the right side. So the firstly, I check the amount of the treatment. So now I can make the line very easily comparing with the right side. But when you are treating the asymmetry patient like Dr. Nicholas, so you should comparing the amount frequently. So. Yeah, please. Close your eye, please. So, if you are making a too wide line, comparing with the one side, don't worry about making any bigger line. So I made a too wide line here, but I don't treat this side between the first line and second line. So I made a too wide line in the left side, but I don't treat the left side more, but I will treat making the more line here, not treat it too much. Sorry. I only make some line, not treat too much, because patient can complain of the difference between right side. So not treating the inside over here, because after that you can find the middle plate. Yeah. So after some time later, about 5 or 10 minutes or 20 minutes later, the patient can feel the pain. So if the patient can feel some pain, you should treat the air pull-up. So it will make a pain relief. So I recommend him some pain relief, and after that I will treat him. So okay, finish. So you will widening of this here, this epicenter fold, and so I think your eye is looking more smarter than first time, because this will widening of your eye. So that's right. So I think she has some acne lesion of Komodo. So I will show you the method of treating this lesion. If this is more active and yellowish discharge, you should try making some pore. It's a little pain. So oh yeah. So did you have some skin ointment? Enna? 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 At this region? Clean up, okay. So making the round circle around this region, like here. A little bit pain. And the inside of the circle, making some pore. Not making any distinction. So in some time later, you will decrease about 5 or 6 days later. I think there is no the Komodo. So that's all. So skin spot? Where is it? Are you here? I think this is another acne lesion. So making some around the line here. Make some point. So this is the skin spot. This is very easy. So you just finish it. So skin is very. In my clinic, the chair is very comfortable for my treatment, but this chair is not so easy for treatment. So I have some back pain problem. So let's finish it again.
Do you
Okay.
always do it with the patient sitting up?
Mm-hmm.
Do you do this treatment with the patient sitting up?
Yeah, sitting. But I can. There is no bed in here. But if there is some bed, I can treat the patient in spine position, and after that I will making the patient sit down, and finally I make the original line. So
When do you do that cut? I noticed that in your video, you did one where you cut across here.
so no cutting, and
Are we using this one to burn? When do you do that?
so because the epicanthal ligament is the inside of the skin, so but even though we don't make any skin incision, so because the flexor has some energy, so the epicanthal ligament is not more solid material, it is a ligament. So when you are treating the flexor around the epicanthal ligament, the ligament is loosening. So yeah, loosened. So you can find the widening of the skin like cutting. But if the fold is very thick and strong, it's not of no use. But most repeat patient, so it is very effective. So, and widening of, you can find the widening of the folds. Okay. Mm-hmm.
You had to do all the procedure when the patient is sitting or lying down.
First to the spine position, and after finally sitting position and checking the amount
You
of
mean
the.
lying down sometimes. You like to do it lying down or this time?
Yeah, lay down.
Lying down better.
Yeah, back. Because it's very easy for you, for surgeon. So but sitting position, you're like here, so you will make some back problem like me. So yeah.
So
Yeah.
my patient with the thin skin,
Yeah.
sometimes they don't have some unexpected double fold.
So when treatment for the thin skin, you should not make a very wide line because it will make her eye more bigger than the previous time. So I think when treating the thin skin, you can find the immediate effect of the making very big back double fold. But you don't worry because after 1 day later, the swelling will decrease and the skin will be made good. But not make too much for treating the thin skin patient.
So the flexor doesn't make any unexpected fold.
Yeah, so but if you have some unexpected effect is the asymmetry, and you can treat her second time to your clinic. So after 2 weeks later, you can treat another session. So that's very easy. But I think there was no undesirable effect. But some if patient when treating the epicanthal region, we can find some very yellowish discharge or like the abscess, but it's not abscess and it's the healing process. So you don't worry.
So you've never encountered any PIH?
Yes, I have 300 cases, no PIH. Skin redness will, some patients, the redness of the skin will lasting about 30 days later, but mostly they will be improved. So you don't worry. Another thing. And after treatment, good. Is there any hydrocortisone ointment and treat the treating region here. Very- Because it will make a little swelling and a little pain. But now in treating the hydrocortisone ointment, it is necessary for prescription. So now we are treating another ointment. So, but this is the same. Yeah. The epicanthal for the double fold lesion and ointment is necessary. I will explain the third case, and she is complaining of the symmetry of the double fold line. So I think her right side is a little bit wide, and the left side is very narrow. So I will making the more line and left side, and in outside of the right side I will treat it like here, and the inside I will like inside of the fold, because I will reducing the widening of the fold, because the widening is not so beautiful. So I will making some balance with treating the flexor. So so firstly, I will design the narrow area, like left side, because when after that I can make some balance of the right and right. So firstly, you should treat the very when you are trying to treat the wider area, treat first, and second, and the small area you will treat the second time. So I will treat firstly I will make the line more wider than left side. So I will uplifting of the 1.5 millimeters. So I will treat over 3 or 4 millimeters from here. So I will make some 3. Is it painful?
No.
No. Yeah. So. Some doctors asked me about the kind of this handpiece, but I don't know exactly kind of. I think I treated more than 300 patients, but I treated only 2 handpieces. So when the time is gone, this flexor is changed to the color is changed to red one. So now this is the green one. So here I place. So I think we can find the widening of the fold, like here, left side, before treatment. Because I think her skin is very thin, so we can find the exact effect of here. So I think the medial side of the right fold is too big, so I will reducing this line. So I mentioned before, when you are treating the reducing the fold or the depressed wrinkle, you should treat the protrude region. It's the same with the eye surgery. So I will treat the inside of the original portion, like here. It's more painful. Yeah? No pain. Yes. So I think she's a very good patient. So candidate. So. From your ideas. Okay. So this will actually make some contraction of the skin and some healing. So it's treating up here. You can check out the decrease of the medial fold of skin. So okay, open your eyes. So now the medial portion is decreased a little. So I will treat it later. Okay. Open your eyes. Okay. Close your eyes. And laterally, I will make the here. If your patient don't have any complaint of the widening of their eye, you don't worry about treating plexus a little, because I think less is better than more for treating the plexus. Open your eye, please. Okay. Close your eye, please. Open your eyes. Do you have any tooth stick? Tooth speaker? So give me some cotton bud. Yeah, cotton bud. Okay.